All right, Jennifer, would you like to get started?
Sure. So I think we're going to start by both introducing ourselves and then we'll dive into the topic. I'm Jen Magee. I'm a general dentist here at Mass General. I've been at Mass General since 2007 when I did my residency and I loved it, so I've stayed here. I see patients of all ages. I treat patients in the clinic, and then for some that have a hard time tolerating care in the clinic, I treat them in the operating room. And I'm the service chief of dentistry at Mass General.
And I'm Jill Pineda. I'm one of the psychologists at the Lurie Center. And I have do both neuropsychological assessments and also therapy with a particular interest and expertise in desensitization or helping patients tolerate medical care. Um, all right.
Excellent. So tonight we're going to talk about dental care and things that might be challenging for somebody with autism and experiencing that. I'm going to start by talking about some general dental terms, things that we see, treatments that we offer, and then we'll dive a little bit deeper into ways to help prepare yourself or your loved ones for those dental visits. If you want to. And then next slide. Whenever I talk about this topic, I always like to talk about why are teeth important. And I think most of them are really obvious. Teeth are important because we smile with them. It's how we greet each other. There's an aesthetic component to it. They're also really important for eating and adequate nutrition. And we have a good complement of teeth to help us both rip in and tear food like those front teeth are, like the child there is with that nice raw carrot. And then our back teeth are really good for grinding. So the having all those teeth present help us to have a nice, healthy, wide-ranging diet. It's really important for speech, both the position of the teeth in the mouth, the shape of the teeth, the shape of the roof of the mouth, help us to form certain sounds. And then the baby teeth, I think sometimes the baby teeth are undervalued, but one of the big things they do is hold space in the mouth so that those adult teeth have room to come in the proper position so we can use them for all the things above. And then we know that, things in our mouth are important to the rest of our body. There was one of the seminal works on that is in 2000, the Surgeon General's report came out and talked about how you really can't have good overall health unless you have good oral health, and that there's lots of connections to medical conditions that are influenced by the mouth, including diabetes and cardiovascular disease. But I think a lot of times we don't necessarily connect it to the rest of our overall health, and that's more of like a political and insurance construct than actual health one. So I think it's important to start from the very beginning. So our teeth start to form very early in utero. You can see here on the left side, there's baby teeth. There's 20 baby teeth typically that come in. They will come in, those front lower teeth come in first, and then they typically come in order with like the upper front teeth coming next, then the side teeth on the lower and the top, then some molars, and then the canine teeth in the front. But even as those teeth are coming into the mouth, we have the adult teeth in the jaw forming and coming in. We tend to find that in patients with autism that that there can be delay of eruption of those teeth by almost a year. So there's a wide normal range for both the loss of the baby teeth and for the adult and baby teeth coming in. And for those with autism, that can be even a wider range. That can cause some problems just as the jaw is growing. There can be crowding issues and other spacing issues if the teeth don't come in the expected order and space. And that's something that we deal with orthodontia. There on the right side, you can see the adult teeth. In the jaw there's 32 teeth. For those, the back molars don't replace any baby teeth. They come in separate from those. In the back there, the first molars come in around age 6, and then those third molars come in around 18 to 20. That's why we call those the wisdom teeth. And you can see by the different teeth there, like I talked about, those front teeth are really ones that are important for tearing into food and gripping things. And those back teeth really help, with like salads and lettuce and things that need to be ground down. do the next slide. One thing that we worry about a lot can be malocclusion, which is just like the sort of not perfect alignment of the teeth. There's lots of different variations there in that the photo. So it can come from a lot of different reasons. Very few people have teeth that are perfectly aligned and stay perfectly aligned over time. Sometimes it can be a difference in the jaw shape or size, the way the jaw fits together. Sometimes it can be missing teeth that allow other teeth to shift around. They're going to be crowding. So sometimes you have somebody with a smaller jaw and bigger teeth. And sometimes impacted teeth, which means teeth that don't come into the mouth when we expect them to, and they get stuck in the bone and the gums there. So all those things can become problematic, and typically the way we think about fixing those are with an orthodontist, so a dentist that specializes in the teeth and jaw and straightening those. We're going to talk a little bit about some other issues that we deal with dentists, and I think all of those play back with when we think about if you want to have braces and see an orthodontist, because while you're having braces, you're at a much higher risk of gum problems, cavities, and then once that work is done, you have to think about wearing a retainer for a lifetime. So if you or your loved one is thinking about correcting your bite, there's a lot more to consider than just the immediate orthodontia for that. The other thing we think a lot about with teeth is cavities. So cavities really boil down to you have to have these different things in the informatic here. So you have to have a tooth. You need to have bacteria that can convert the sugars in our food into acid, and then that has to be sitting on the tooth for enough time for that to happen. Typically, people don't have the bacteria that cause cavities. Usually you get it from your primary caregiver. So a lot of times that's a mom who's, giving lots of kisses or sharing spoons or sharing, cleaning pacifiers with their mouth after they drop on the floor. So that's why in families, we often see mothers that have a lot of cavities can have kids that have a lot of cavities. And that's just because they have this sort of bacteria that can be just as effective in causing those cavities. The other thing we see here is that the time is a really important part of it. So it's not just like what you're having someone eat, but how long that is going to stay in their mouth. So if you have someone who isn't going to let you brush very well or is pocketing food, that can become problematic because the time that the food's in there for is going to be longer. If you have somebody who really likes certain types of foods that are very sticky, that can be a problem. You think of those like gummy snacks and things like that are going to like stick in between the teeth and make it really hard for you just to naturally clear it. And then again, if you are just, not brushing all the time, or if you have something that you're eating over a long period of time. So I often give the example of a cup of coffee that has milk in it. And if you have that cup of coffee and you just eat it with your meal and then you're done with it, versus somebody who is going to sip on it all morning long, the person who's sipping on it will be much more likely to experience decay. For patients that have either growth problems or failure to thrive or issues where they are not, where their dietary issues are a bigger issue and they're being fed more often, that can be a problem too, because people that are more likely to be grazers, eating a lot in between meals, are just exposing that bacteria to more sugars and making it more likely for tooth decay to form. When tooth decay forms, you can see this little picture here also. So you've got our tooth here. It's got the cover of enamel on the outer part of it. The enamel can have pit and fissures through the top part of the tooth. Bacteria can get in there with the sugar and cause a cavity. You can also get cavities that's sort of labeled smooth surface cavity there. It's in between the teeth. So we think of, decreasing the time there by flossing. For people that have gum disease and have a little bit of bone loss, the root of the tooth can be exposed, and because it's not covered by that enamel, you can get decay that starts on the root and can extend pretty quickly. When we notice these in the mouth, there's a few different things that we can do. to help, either reverse it or to treat it. So if it's a cavity that is just in the enamel part of it and hasn't gone any further than that, we think about doing things like fluoride treatment. Sometimes when they're a little bit deeper, but still on the smaller side, we can do things like silver diamine fluoride that you might have heard about that turns the cavity itself to a dark color, but it can help to kill that bacteria that's in there and arrest that. Or we can do a filling where we go in and remove all the cavity that's there and put a filling in there. Sometimes if the cavity has progressed to the point that the nerve is impacted, then we think about doing like a root canal. And then if it's so significant that either the tooth has fractured or there's a bad infection, we think about removing the tooth entirely. So there's a wide range of things. We always want to try to keep them as simple as possible, and that typically means diagnosing it as early as possible. The other thing we think a lot about is gum disease. So the pictures here on the left is the upper one is of healthy gums. You can see they're pink, they're a little bit stippled, which means they just have like little kind of dots in it. They look pretty healthy. That lower one is, you can see the kind of yellowish, thicker material along the gum line there is plaque buildup. And when that's not removed, it will irritate the nerve, it will irritate the gums and cause inflammation. And that's gingivitis. So on the pictures on the right here, we have the top one is just like a healthy tooth that's sitting in the bone and the gums. It's, being cleaned regularly. There's no buildup along the tooth. There's no inflammation. The next picture shows a tooth with some like either calculus, which is like hardened tartar, or plaque there. It's sitting and not being removed. So the gums are starting to get irritated around it. If you leave that over time, the irritation and inflammation of the gums is going to cause irritation to the bone underneath that supports the tooth, and you're going to get bone loss there. And that's what periodontitis is. So that makes the bone and the supporting structures, it will cause that loss of that. And then over time, you can have more sensitivity because more of the tooth is exposed. You're more at risk for other types of cavities because that softer part of the tooth is now exposed. And then if in like that last picture there, if it becomes advanced, you can even experience mobility and tooth loss because of that. So it's something we definitely want to avoid. And the way we typically do that can be, the way we typically can do that is, by home care. So brushing and flossing, I think we know that even though that sounds really easy, that can be really difficult with some people. One of the big issues that we run into is just sensory issues. So typically I talk to families about I think sometimes you have to try a lot of different things. Sometimes like a manual toothbrush, just a regular toothbrush can work. Sometimes an electric toothbrush is better, but some people find that overstimulating. So you have to try different things. Sometimes you have to try different tastes and flavors and textures of toothpaste as well. That can be very challenging too, to find the thing that you want. We also find for patients that sometimes location is really important. So some patients do much better to brush while they're in the shower, or in a certain part of the house, or with the prize of being able to watch something they like. Really finding those things that motivate can be really important. And the goal would be to brush for 2 minutes twice a day, and brush, everywhere, each side of the tooth, the front side, the back side, and that can be very difficult. The other thing that we see is with some people, depending on the medications that they might be taking, a lot of medications will cause inflammations and puffiness of the gums, and that can make it a lot more challenging to really get in there and clean. So that's something you can discuss with your dentist and with your doctor if a problem. And sometimes what we have to do is actually go in there and surgically remove some of those gums, or alter the medications to help make it easier to brush and keep those gums nice and healthy. So another thing that we see a lot of is clenching and grinding. So there's many reasons that clenching and grinding can happen. I think a lot of times For someone that's neurotypical, you might think of it as being stress or coping with anxiety, but there's lots of other reasons it can happen. One can be just for feedback or a habit. It can be self-soothing or sensory seeking behavior to grind. It can be, we know that grinding can happen because of malocclusion, like the spaces where the teeth are, if they're out of alignment, sometimes that can increase the grinding. It can be normal development. Sometimes in children, it's just, many young children will grind, and then as their adult teeth come in, they stop grinding as much. It can be an airway issue, especially at night. We're understanding more and more about that in dentistry. It can be, for people with obstructive sleep apnea or other ways, it can be a way of opening up the airway by moving the lower jaw around. Clenching and grinding can definitely be medication induced. So that's something also to talk to your the primary care provider about if it's something that you're noticing a lot of. And then the other thing we see sometimes is just like fractured teeth and self-injurious behavior, and that can cause the same types of problems where you can have fractured teeth. Over time, if you're clenching and grinding, like that lower picture there, you can have loss of enamel. We worry about that because there's only so much tooth before you get to the nerve of the tooth, so you can increase sensitivity. You can have risk of pain, risk of infection if it gets close to the nerve. And then, muscle pain and headache. So oftentimes you'll hear people who are clenching and grinding having, waking up with headaches because those muscles, it's like your muscles have been running a marathon. They've been working all night. They're very fatigued. For this, it's limited in what we can do for some people. It really, one option is always a night guard. So that's something that we have to take a mold of in clinic to make, and then someone has to be able to tolerate wearing it, typically at night. For a lot of people, that's just something that they can't tolerate. When the clenching and grinding get very bad, sometimes people consider having Botox to help relax the muscles here to make it so that less force can be generated. So that is also an option for some people. But I know it can be hard. I think sometimes it's hardest for the people around them because the clenching and grinding is a very difficult thing to hear. But I think that's perfect.
Thank you, Jen. So I'm going to present on, you learned a lot about the teeth and the importance of brushing and dental hygiene. I'm going to present more on like kind of the behavioral and emotional component of dental care or going for dental treatment, because I know that can be challenging for many individuals with autism or related difficulties. So first, I just wanted to highlight some of the common barriers to healthcare in general, but I think this certainly applies and brings up some of the challenges that occur in a dentist's office. So this is a study where healthcare providers and parents were asked what the most common barriers to their child's or to children with autism's care is. And I think it nicely highlights the different perspectives where healthcare providers, the majority suggested that a child's behavior was challenging, that they might have been uncooperative or unable to complete an exam or the physical components of a visit. The child might have been fearful, so certainly there's a lot of anxiety that occurs. Parents can be overwhelmed, which is completely understandable. I know how much it takes to even get your child to the dentist or the doctor at times. So I think this nicely highlights some of the perspectives of healthcare providers, but I think it's important to also understand the parent perspective. So a lot of parents most often said the provider or staff didn't understand the impact of autism. So I know how important it is to really find a provider who you feel like understands your child's needs. And I'm already seeing some questions and comments in the chat that kind of highlight that. We know that environmental issues like difficulty waiting in the waiting room for a long time, lights, noises, all of the sensory aspects of visits, even before you go into the office, can be very challenging. And then oftentimes there is a fast pace of office, and that's no one's fault, but that makes it hard for, I think, sometimes our patients to be able to get through a visit or complete all of the parts of a visit that may typically be done. So I want to talk a little bit about anxiety and fear of medical procedures, in particular, applied to dental visits. So we know that many children have challenges in going to dental visits. And we also know that one negative experience can have really long-lasting effects. So that might even lead to a lot of anxiety just leading up to the procedure, needing to, even talking about it before you go, or getting in the car, walking into the building. I know it takes so much even to get there. So I always like to pause and kind of think about, when is a procedure absolutely urgent? Like you need to have annual visits, you need to go for medical care, dental care, versus when can you take a little extra time to prepare? So trying to think about, is there time to prepare and what can you do? I'm going to share some strategies or things you could do ahead of time. And then also think about, are there parts of a procedure or dental visit that could be eliminated or accommodated to help your child or individual with autism feel more comfortable? And this might be a discussion you need to have with your dentist or a healthcare provider. But I think it's helpful to think about like whether or not there is something to accommodate any challenges that you might anticipate. It's really important to highlight that we know that parent response and demeanor can really change a child's behavior and anxiety. There's a study here that I highlighted. This is around just needing injections or vaccines, but the same, parent responses apply for all medical procedures, dental visits. So we know things like excessive reassurance. So saying, it's okay, you're going to be okay. Criticism, like you're not doing a good job. We talked about this. Why are you behaving like this? Or apology. So even saying like, I'm so sorry. All of those things can actually really increase distress and anxiety. So you really want to pay attention to your own reactions and behavior. And on the flip side, you want to think about what can you bring to the table to help your child feel most relaxed. And we know that the use of humor and distraction can decrease a child's reported distress or anxiety. So talking about preferred interest, highlighting something special or a special reward you can go, something special you can do right after a visit, giving lots of praise and incorporating humor as much as possible. I'd say the strategies in general to remember are to stay calm, that your response matters. So if you need to swap out with another caregiver, that's completely okay. And that might actually help your child. You know yourself the best. And so think about whether or not that, what you need to do or what support you need to help get through a visit. I would say in general, you want to try to limit attention to unwanted behaviors. So if there's a lot of whining or, protest of I don't want to do this, trying to redirect and offer distractions rather than getting into a verbal back and forth. If your child is verbal, I think it's really important to pay attention to the attention that you're giving behaviors. You want to give lots of praise. So give specific and positive praise around what your child or loved one is doing well. So being very specific, like I love the way that you're holding still and keeping your mouth open for the doctor, or I love the way that you're waiting patiently for the doctor. The more you can give positive and specific praise, the more likely it is that your child or loved one is going to continue to try to engage in that behavior. And again, incorporate humor and preferred interest as much as possible. So that can go a really long way. As far as preparing for a dental visit in particular, so these are some of the strategies I might use for any kind of medical visit, but really applied to how to support someone at the dentist. So, oh, I'm sorry, it's highlighting it in a special way. So the first thing you want to do in what I would do if I was helping someone who had anxiety around going to the dentist is to talk about it. So in general, while it works in a subset of individuals, I'd say in general, you don't want to make it a surprise. You really want to talk about it and let your loved one know that you're going to be going, and really just start to set that expectation that you're going to go and be able to kind of talk about it or communicate the expectations. And that could be in a variety of ways. So even if there's not verbal communication, I'm going to show you some other tools and strategies you could use. But I might first start with explaining what the dentist is, why you go. So it's a doctor that checks your teeth and gums. to help them stay clean or help you stay healthy. I might talk about the benefits of going to the dentist, and how, as you heard, it's important to keep your teeth clean and healthy, but it has an impact on keeping your body healthy. I might talk about the risks of not going, so highlighting both the risks and benefits of the care. And then most importantly, if you take anything from this, I would say be honest about what to expect. So as a parent myself, I know there's this, it's hard to talk about the pain, or it's hard to I think set that precedence that there's going to be pain, and it's easier to say, oh, it's not going to hurt, especially if you've been through it and don't think it's painful. But I think it's really important to be mindful of any kind of pain or discomfort that they might feel, and be honest. You don't have to go into excessive detail about that, but saying you might feel uncomfortable, you might feel a brief pinch or pain. Certainly you want to understand what exactly they're going to have to tolerate during the visit, but it's really important to be honest. I'd say the next step, beyond just talking about it, letting your loved one know that it's going to happen, is maybe looking for a social story or looking at pictures of what to expect and what someone will experience. There's lots of social stories for dental care online. I pulled some websites of 2 that I found that I thought were good, and this is really going to be varied for each person's cognitive or communication needs. But I'd say just walking through the pictures in a way is a form of desensitization, because you're going to start to see some of the materials, you're going to see what's expected. As when I put my neuropsychologist hat on, I also always think about communication, and this is a tool to really support understanding of what to expect. And so I think it's a communication tool, it's an anxiety tool, and it's really helpful. So looking for a social story and reviewing it with your loved one would be really helpful ahead of time. If I were taking that a step further beyond looking at a social story, I might actually start to look for videos of maybe a dental cleaning, or to really get a real-time picture of what's expected and what your loved one will have to tolerate. I think there's something about the real-time exposure that is helpful even beyond a social story, if you can find a good one. It's important to look for a video where someone's not having a large or aversive reaction. I found this video that shows, an adolescent who's going to get teeth cleaning. So there's a lot available online. So I would preview those before you show them, but I think it's a really helpful step as well. The other thing that think about is, what are things that can you decrease anxiety around any of the other parts of a dental visit or doctor visit before you even go? So if there's a way to decrease anxiety around the location by making a visit or looking at pictures of the location, just having that understanding of that's one less thing that someone has to anticipate or be surprised by. And so becoming more familiar with the place can be really helpful as well. And then finally, I would say when I'm thinking about desensitization in particular, which is kind of the gradual exposure and practice to procedures, that practice, as much as you can, that practice at home to help support understanding of what to expect and decrease anxiety around parts of a procedure can be really helpful. So you might even consider practicing or getting ready for a dental visit by modeling, and this might be as simple as setting a timer and having your loved one sit back and open their mouth, and you might, just brush or put the brush in or count their teeth, or, do what they might in general. You're not gonna have all the tools that a dentist has, but you might take little steps at home to help them get familiar with the experience of what that might feel like. You might have them kind of practice on you as much as you feel comfortable, or practice on a stuffed animal. But this actual physical practice often is what makes the difference in decreasing anxiety in the long term. The other thing I would say, and Jen, I'll let you speak to, I think there's a question about whether or not there's any kind of recommendations around more frequent cleanings, but I've had many patients who really benefit from more frequent or regular appointments for cleanings, at least from a behavioral and emotional perspective, because in a way it provides probably, helpful cleanings, but also I think it really provides that form of desensitization to get used to going. So you might consider scheduling more frequent visits to promote comfort and familiarity with the process, as well as the cleaning, actually getting the physical cleaning. But also you might make a visit to see the space or sit in the chair, go in the room. I would say it's important to also adjust your expectations. While you want to have kind of hope for the best, I think plan for the worst in some ways. Adjust your expectations for a single visit rather than forcing dental work when it doesn't absolutely have to be done like right then. That might be a time, if you're seeing significant anxiety or behaviors, it's better to kind of take the time, prepare, regroup, and try again another day. So kind of and I would love, Jen, your thoughts on that as well. But when possible, I would avoid restraint at all possible, because this just increases anxiety and makes it more difficult the next time they go back. And as much as possible, I would keep appointments short and positive. If you can end on a positive note with something that they can do, that is better than forcing something that makes them feel very anxious. So just take small steps and recognize that it's not all going to get done in one day. But you can get there, and it can get better with this repeated practice and some of these strategies. I found these great resources from the NIH that there's a guide for dentists on caring for people with autism. It's a provider guide on strategies for providers, but there's also a guide on everyday dental care for caregivers. So I just wanted to include those links because I thought they were helpful when I was looking at them. And they're specifically designed for autism or individuals with special needs. I also, I don't expect you to use all this, but I want you to have this slide basically because I sat down and thought about what are questions that I would want to ask a dentist as a psychologist, as if I were preparing someone who is really anxious around going to the dentist. These are a list of questions that I might ask the dentist or office staff. Like, what are the expectations? So what exactly is expected within the visit? How long is the visit? As knowing what's going to happen really helps you anticipate what might be challenging and advocate for your loved one's needs as much as possible. So how long is it? What needs to be done in advance, during the procedure, or after? If there's any accommodations that could be used to help your child or loved one. So whether, there's a way to schedule at a less busy time, or if there's typical accommodations that might happen for individuals who have sensory sensitivities. These are all, I think, good questions that could be helpful. If you have a dentist who is experienced in working with individuals with autism or other developmental disabilities, you might even ask what's been challenging for other patients and what has helped them to be successful. So starting to open up that conversation. And then are there staff that could help support my child's success? So are there particular staff that they're really familiar with or that are experienced in working with individuals with autism and developmental disabilities? And can you plan a visit ahead of time to see the chair, see the space? Because that's one less thing to have anxiety about. And then finally, I just want to highlight, I actually do a parent desensitization workshop that's on medical procedures in general, but and it walks through the steps of desensitization and things you could do at home with some of the strategies I've shared with you, but in much more detail. And while it's not just around dental care, I would say the strategies really are helpful for dental care. So if you feel like you need more guidance or want to think through this more, I do have a workshop that's offered a couple times a year that is insurance billable. So there's some information about that. We wanted to leave plenty of time for questions. It looks like there's some questions in the chat. So I will pause and Jen, I don't know if you want to start with answering. I think there's a few questions I thought you might be if we could start at the top, and if you want to get started with answering some of those.
Sure. I will actually start with your questions or your comments to me. So I definitely agree with you about setting the visit up for success. And sometimes, sometimes it's just not going to be the day where you're going to get a lot done. And I would rather someone either, cancel the appointment or, start off with thinking maybe it would just be more of like a meet and greet or just limited care that day, and then to have a appointment that didn't feel successful to the parent or the patient. So I think it's the more information you can share with us about other things that are going on, things that you're worried about, potential triggers, all of those things really help to set us up for a good appointment. All right, so I had looked at some of these. I think there's a recommendation for some local people, and there was some in the chat. Let's see. So, I think for a lot of patients, more frequent cleanings would be helpful, but unfortunately, dental insurance is pretty, regimented about that, and they'll typically provide only the 2 a year with some exceptions. Sometimes Blue Cross Blue Shield, if you have both medical and dental insurance and you have a diagnosis like diabetes, they'll consider the extra ones, but we're always happy to write letters on behalf of patients to try to get more covered, but unfortunately, typically it's more of like a self-pay thing for them to have. Can a retainer be made to act as a mouth guard? Sometimes it can. It has to be the retainer because our teeth want to have good memory to where they used to go. It has to be pretty firm and cover a lot of the tooth. So a mouth guard can be built up and made out of a strong material to act as both help with grinding and to help keep the teeth where they are. And then the second part of that question is about group homes. That can be a very challenging issue. A lot of people that, a lot of our patients that live in group homes really struggle with dental care. So one part of it that I often think about is that the people that work in the group homes might just not know how to take care of their own teeth that well. So we're like sort of presuming that they both know how to take care of teeth in general and that they know how to take care of someone else's teeth. I think sometimes either because of behavior or again, just because they don't know, they worry about things like being bitten or doing it wrong, or they just are not doing it well enough. That's one of the things, like whenever I see somebody from a group home, they typically need to have like notes from our dental appointments. So I will give some guidance on that and my clinical note and the note I send back to the group home about things that need to be done better. I think that helps some, but oftentimes it's really can be a challenge for some people.
I see a great question about whether or not there's any mobile dental hygiene services that would be really helpful for group homes or day programs. Do you know of anything like that?
I don't. It's sort of a dream of mine to have like a mobile unit that goes around for exactly this reason. I'm not aware of any right now, especially none that I think there's some mobile units around, but a lot of them either are focused on like they go into like nursing homes and do it there, or they're like completely self-pay. So none that I know of that would take any kind of insurance to do
I know
that.
there's a mobile like vaccine, and I know even I just learned about a mobile mammo van that does mammograms.
Yeah,
So I think we could do this. So if
I
you
think
ever
so.
want
Yeah, definitely. Um, so they're flaws.
a lot of great questions. Sorry, we're just
Yeah,
reviewing.
I know it can be so hard. There's a question about like a teenage daughter that just isn't brushing or flossing, especially with braces. I think sometimes what happens is that as the gums get puffy, like we showed about in like the gingivitis, is that they can be like really sore and sensitive, and that or they can like bleed either from like flossing or just from regular brushing. And sometimes people that makes them nervous and it makes them think, oh, I must be doing something that hurts me if it bleeds. And really that's more just a sign that you need to be brushing a little bit more. So sometimes again, like sort of working through different technology things, you don't want to spend a lot of money on things that might not work, but like some people really like a water pick or some other, or like flossers that are on sticks or different things that make it, there might be a challenge to the brushing and flossing that just isn't clear. It might be, especially if they're in braces, it can be overwhelming. There's just like, there's a lot of spaces that food gets caught. It can be really hard to brush around them. The thing I hate to see is you spend all that time and energy and money doing braces. And if the home care isn't really good, once the braces come off, there's either new decay everywhere or like gum problems. And that can be really sad. So keep up pushing her, and then hopefully you're with a good dental home that you feel like she's listening to and is willing to take their advice when they come in. Sometimes people will ask for like disclosing tablets, which is like it stains the plaque a little bit, so that can help motivate people, especially during braces, to show the spots that they're missing. But you know teenagers can be tough, and that's a tough age. And I think getting individualized care, and maybe she might be somebody who really needs to go in every 3 months instead, and then her gums will feel better, and then she'll be more willing to brush at home. Let's see. So is there anything Massachusetts can do to encourage more dental providers? I think, I think they are. So this next question's about Mass Health, and it's really difficult. I think historically the reimbursement rates for Mass Health were just like incredibly low. So it was hard to have a practice where you could support all the like rising costs of employees and supplies under with the Mass Health reimbursements. But I think Mass Health is really, they take the obligation they have to the people that have Mass Health really seriously, and they've just increased some of the core group of the most common codes that dentists use to get a little bit more reimbursement from it. So I think the hope is that more providers will be able to take Mass Health. So I hope to see that change in the coming years. I know the current Mass Health dental director is very, very dedicated to increasing access to care by encouraging more dentists to take Mass Health. So hopefully, hopefully that will improve. And then have you dealt with adults with autism who are in groups homes? Yeah, I see quite a few adults with autism who are in group homes. Again, it can be challenging in a lot of ways. It can be challenging for like the home care, for the diet, for access to care. I find that it seems like they are pretty strict about at least documenting that they take them that they've taken the person for cleaning. So sometimes that can help to motivate them to keep up with that. But it can be really difficult. Even when we were talking about cavities, some people benefit from having like a higher strength fluoride toothpaste, and that's very simple if your loved one's home with you. For a group home, that can be unbelievably difficult just from the bureaucracy of trying to get them to have like a medication that's administered in that way. So we deal with a lot of different unique challenges when people are in group homes. How do you get your teen to brush adequately? Again, about the braces, she thinks brushing is 10 seconds. I think sometimes for teens, they are on a mobile device all the time. There's some like good apps out there that will measure the 2 minutes, sometimes with like a little game, sometimes with just like a timer. I think that's usually the best way to do it. I think it's always important too to mention it to the dental team when you go in so that they can help reinforce the importance of that. But teenagers are tough. So I think whatever that motivation is, sometimes it can be tough. So sort of finding the right person to give the consequences without making it too judgmental and making it approachable is what makes the difference.
And I would say, you mentioned timer. There's a great timer called the Visual Countdown app. It's free on like most smartphones, but I really like it because you can personalize. There's a picture that's revealed as it counts down. So I use that a lot in desensitization protocols. So it will count down and then reveal a picture, and usually makes like a cool sound that is associated with the picture that it shows. So it's kind of a fun one to serve as a distraction, but also a reminder of like how much longer you need to brush or hold still.
I think that's perfect. I mean, I find myself, I'm a dentist, I know better. And when I'm using my electric toothbrush that is a Sonicare and it sort of goes for 2 minutes, I definitely brush better than when I'm using my manual toothbrush and I'm not counting, because I know I just don't brush as long. 2 minutes is a lot longer than you think it is. So I think any sort of aid you can do to try to do that is important and helpful. And the mobile devices, yeah, the mobile services, I totally agree that would be very helpful.
It looks like there is a question here on my daughter has severe autism and multiple visual impairment issues. Her biggest phobia is the dental chair, especially when it's reclined for the exam. We're working heavily on a dental descent program and more frequent visits. Any other suggestions are greatly appreciated. Jen, I know this was something we briefly talked about, and you had mentioned a little bit of your work, so I thought your work might be really relevant here.
Yeah, so I mean, I actually don't ever recline patients. I find that, I guess very rarely, occasionally if somebody has like a backache or something that they'll feel better being reclined, I do that. But otherwise I leave everybody sitting upright. I had done some work for some time with people that had experienced trauma and had PTSD, and I found that they felt much more comfortable sitting upright. And then I just sort of started doing it with all my patients. And certainly, it's very difficult for patients to be reclined. It's like harder sometimes with like the water in their mouth and other things. It's just very triggering to them. So if you can leave them sitting upright, it might be something you want to suggest to the dentist, or see if they can sit them up a little bit more. For my patients, sometimes if they don't want to sit in the dental chair, we start by them sitting in, my chair, the doctor chair, and we see what we can do there. And then maybe over time they feel comfortable and we move to the regular dental chair, or maybe not. But I think it's important to be as flexible as possible. And if you think that reclining is something that's going to be difficult, if you share that, I think a lot of times providers can try to find a way around it. And then maybe over time, when they feel more comfortable, maybe you can recline it if the provider really just feels like that's the way they work best. But I tend to leave everybody sitting up, and I think people like it. I think everybody likes it a little bit better.
Yeah, absolutely. I think it puts you in more of a position where you're not totally out of control.
Yeah. I
And
know the other thing that you had mentioned was the restraint. So like I also am like just not a fan of that at all. I think it's better to for the most part end the visit successfully, like you mentioned, versus doing something that is going to be very stressful. I think about it in a real basic way of like fight or flight. That's what I don't want to activate, to keep somebody like calm, because once you start activating that, I just think it takes over, and it's really hard to get back to baseline after that. So anything to keep people calm and comfortable is just going to make the visit more successful.
right. And I would just add, like, those gradual visits, even though you're not getting everything done in the long term, I think if you can leave successfully with little bits, you will see a big difference over time. So many families say, oh, with time and with like just repeated visits, it really has gotten better. So yeah, I think
Yeah. And I think, one of the things that I have run into is I think people are used to like traveling to Mass General from far distances. And I think for this type of work, it's really important as best you can to have somebody locally, so it doesn't feel burdensome to get to the office. Because for the most part, I think most families are exactly on board with that, like small visits over time, small successes, and they build, and it's remarkable what you can see over time. But if it's something where mentally you're like, oh, we've driven, from the Cape into Boston and it's so far, like we have to do as much possible today as we can, like, and you won't feel successful unless we get through the whole thing. I worry that sometimes that situation makes it really, really hard for everybody involved. So instead of leaving on a win and maybe doing a little bit less, we push to the point where maybe, either the patient just isn't as comfortable and as happy and isn't going to be excited to come back.
absolutely. I saw a few questions about whether or not the slides and video will be available. They will be available online, and maybe if you want to share some more information about that, but they should be available within the next couple of weeks, I believe.
Yes, so we generally send out the slides within 2 days to everyone who signed up. The videos are posted. It can take several weeks, even up to a month, before we will post the videos. But if you go to the Lurie Center website and look under videos, you can see the channel where all our Coffee Convo videos, since we started recording, are posted.
And then there's a question in the chat about someone who's fallen and needs an implant. The implants can be really difficult because the same like types of pressures, either like a force like what happened to initially knock out the tooth, or gum disease from not brushing, or a constant like pressure on it from putting the hands in the mouth or pressing on it, can cause the implant to fail. So sometimes people will either wait until like the behavior is better controlled, or not replace the tooth at all if they think that they don't have a good environment for success. The biggest problem with implants is they can take a long time. They can take up to a year because there's certain healing periods where you have to go through, and they're very expensive. So if you're not, you know, setting yourself up for success in the beginning of it, there may be other options. But I know it's so hard when your loved one loses a front tooth, you want to just get that tooth back in there as quick as possible.
Dan, it looks like there's a question that says, can you talk more about the high fluoride toothpaste? Would this be a good option for a teen who barely brushes?
Yeah, so it's always good to, you know, talk to your dentist, but it can be. So the high fluoride toothpaste that we have, it comes as either like gel or a regular like toothpaste is it's like 5%. So it's 5 times the strength of the toothpaste you can buy over the counter. You know, the biggest thing we worry about it is like fluoride is a great mineral in the proper, like the appropriate amount. So you want to make sure it's kept away from kids so they can't eat the whole tube or have too much of it, and that they for the paste, we want them to be able to spit. If it's just a gel and you're putting in a small amount, typically we don't think of it as a problem if they can't spit it out. But it can be a great option, especially sometimes we use it on like a little tooth fat or a cloth or something. So even if someone isn't very cooperative, it's a way to just get a little more fluoride in there. Oftentimes when we think of cavities, I think of it as like almost like balances, and you're trying to keep it leaning towards the non-cavities versus the cavities, and the higher strength fluoride toothpaste can be one more thing that tilts it in that direction. Yeah, so somebody wrote about, you know, flossing in the group home. It can be almost impossible. I think, you know, again, a lot of times, like, I think they either might not know how to do it themselves or they're worried about being bitten. Sometimes those little flossers, I know they're like terrible for the environment, but they serve a good purpose. Those might be helpful to try to get, you know, the staff there to use that instead. But that is a very difficult thing to get.
So that's a good question.
Yeah.
Providers and sharing resources.
Sorry, what was the question?
Oh, I was just saying there's lots of questions around providers and people nicely sharing some resources.
Oh, good. Perfect. Yeah. There's a question about, so we talked about the high fluoride toothpaste, and then there was one about, you know, sort of flavors and Tom's of Maine, and, you know, kids toothpaste versus adult toothpaste. I really think like whatever works is totally fine. Like I have lots of like neurotypical adults that like bubblegum flavor and they use kids toothpaste, and that's like whatever floats your boat is fine with that as long as you're using it. As long as I feel like some topical fluoride, so some amount of fluoride in it is important, but otherwise I think whatever flavor your loved one will use is what you should use. Yeah, so somebody said maybe the person can hold a special soft toy when it comes to the dentist. Like I think it's like so important to think, you know, we think a lot about like triggers that are going to make the visit harder, but then also to think about the comforts. So you know, patients bringing in stuffies, that really helps a lot. Sometimes music that makes them feel a little bit calmer is important. You know, sometimes like whatever they find motivating. So I have some patients that love looking at pictures, and, you know, we say like, okay, we're going to do a certain amount of work, and then you can show, you know, me and my assistant your family photos or things, like whatever it is that might make them feel a little more comfortable, a little motivation, and, you know, something that's going to make them proud of themselves at the end, I think is really important. Yeah. And then, you know, somebody said, you know, a son with some self-abusive behavior, and you've tried different things, and you end up having dental care done under anesthesia. And, you know, sometimes that's the best thing that can happen just because it can be hard to tolerate care in the clinic. Typically for my patients that I can only do dental like treatment in the operating room, I like to see them in the clinic every 6 months, again, with the idea of trying to desensitize them to get them used to me. And then if something happens like a fall or some sort of dental infection, I can at least get a preliminary exam, and they are a bit more familiar with the office, but for some people, it's a wonderful tool in the toolbox to be able to take them to to take them to the operating room if we need to. Mental abstract
I
extraction.
think we have time for one more question, and then we'll make sure to get these, you'll get the slides and the video will be posted as well. It looks like there's a question around, do you know a place or hospital for dental extraction under general anesthesia? I personally have just heard from patients. Many of my patients have gone to Franciscan. Jen, I don't know if you have other suggestions.
Yeah, you know, I mean, it's really hard. And I think a couple of the things that we find hard is both like finding a provider if you don't have one, and then that transition from like a pediatric provider to an adult provider. I would recommend trying to get on wait lists as soon as you think you might need it, so that, you know, wait lists can be 1 to 3 years, you know, it can be really long. So as long as you sort of have people waiting. Tufts Dental Clinic has a lot of dental clinics with special needs. I don't think they're currently accepting new patients, but that changes from time to time. Franciscans does, some, you know, Mass General we do, and then some local offices, but it can be limited. So again, I would talk to your primary care doctor sometimes is a really great option. And then look for someone local, because you have to go a lot. So you want to make sure it's convenient.
Great. Well, thank you everyone for joining, and thanks for all the great questions and for sharing resources with one another. Feel free to reach out in the future if you have questions or need more help with desensitization as well.